Preventing liver disease involves adopting a healthy lifestyle and avoiding behaviors that can harm your liver. Here are some tips. Limit alcohol consumption. Excessive alcohol consumption is a leading cause of liver disease. To protect your liver, limit alcohol intake or avoid it altogether. Maintain a healthy weight. Obesity and being overweight can increase your risk of liver disease, including fatty liver disease. Aim to maintain a healthy weight throughout a balanced diet and regular exercise. Eat a balanced diet. Consume a diet rich in fruits, vegetables, whole wheat and lean protein. Limit saturated fat, refined sugar and processed food as these can contribute to liver damage. Stay hydrated. Drinking an adequate amount of water helps your liver function properly by flushing out toxins and waste products. Be cautious with medications. Some medications, including over-the-counter drugs and supplements, can be harmful to the liver if taken in excessive of over a prolonged period. Follow dosage instructions carefully and consult your healthcare provider if you have concerns. Exercise regularly. Regular physical activity can help reduce the risk of fatty liver disease and improve overall liver health. By incorporating these tips into your lifestyle, you can help protect your liver and reduce your risk of developing liver disease. Remember to consult with your healthcare provider for personalized advice and recommendations.